Okay, welcome back, guys. We're continuing with respiratory system. As far as respiratory system is concerned, let's see where we left off. We're getting pretty close to finishing. We should honestly have this video and then possibly just the next, and then we'll be all done. Okay, here's where we left off. We were talking about gas transport. In relationship to gas transport, basically those last couple things that we talked about in the previous video, what I was trying to emphasize was the inverse relationship between oxygen and carbon dioxide. Sorry about that. Just have a message at school.
To answer questions, or I will be in the next 30 seconds. Again, if you have any questions, just let me know. Thanks. Bye.
Recording a video at school. Okay. So as I was mentioning, in regards to the gas transport, just recognizing that oxygen and carbon dioxide have this inverse relationship. Oxygen you need in the body, carbon dioxide you need to get out of the body. That's really it. This is stuff that we were emphasizing in a couple of videos ago as well. Don't have to worry too much about this. The only thing I'm going to just kind of note here, this is just a remembering, right? Just to make sure we're comfortable. Internal respiration is the movement of gases between the blood and body cells, whereas external respiration is the movement of gases between the lungs, or more specifically the alveoli, and the blood. So just keep that in mind. Okay. Moving on down. This looks like a lot. We don't need to learn all of this. This is a little intense. But what this is talking about here is two different types of respiration. Even though it says internal respiration up here, this is actually two different types of respiration. And in fact, you know what? I'm going to go ahead and edit this live. Just leave it as respiration. On the left-hand side, we have the alveoli and the blood. So if there's gas exchange going on between the alveoli and the blood, this is going to be external respiration. On the right-hand side, we have the blood and the body cells or the tissue. So this type of gas exchange is going to be internal respiration. There's a lot of stuff that's going on with this. And like I said, we don't need to learn all the nitty-gritty details, but that's really what this is showing us. This diagram does a great job of just showing you a lot of information that we're going to be learning in cardiovascular system. So we're not there yet, but it's just showing the path that blood has to take and how it interacts with the lungs and the body overall. There's a lot that could be said here, but we don't need to dive too deep just yet. Neural regulation, I'm not going to get too crazy with this either. However, there is some content on this slide that's going to be relevant when we do nervous system, which is a ways away. So I'm going to talk about it just so we can discuss it. The activity of respiratory muscles is going to be transmitted to the brain via the phrenic and intercostal nerves. The neural centers that control rate and depth of breathing are going to be located in the medulla oblongata, which is the structure here. Redraw that. The medulla oblongata, it's a structure found in the brainstem. Like I said, we're going to learn more about that in the future. There's also another brain structure that we're going to learn about down the line called the pons. It appears to smooth out respiratory rate, so it helps to regulate your breathing. Normal respiratory rate, also known as apnea, is 12 to 15 breaths per minute. That's standard. That's when you're at rest. Hypernia is when you have increased respiratory rate, so greater than 15 respirations per minute. What can cause hypernia, or what can cause greater than 15 respirations per minute? A number of things. Talking, so what I'm literally doing right now, exercising, stress, emotional duress, physical pain, a lot of things can cause your breathing rate to increase pretty substantially. Here we see all of that I was just mentioning, just in picture format. We're able to see the breathing control centers, the pons and medulla, the nerves like the phrenic and intercostal nerves that communicate to the muscles around the lungs. And you also see that the heart communicates back to the brain via these O2 sensors, which we're about to talk about in just a bit. Now, there are factors that influence respiratory rate and depth. So there are physical factors and chemical factors. We do need to know both. The physical factors we can talk about real quick. Increased body temperature. When it gets hot outside, and this is Florida, when it gets hot outside, you're going to increase your body temperature. And as a result, your breathing rate is going to increase as well. Just think of dogs. Dogs don't sweat, so how do they cool off? They pant. We don't pant, but our breathing rate does increase when it gets really hot. On the opposite spectrum, when it gets really cold, your breathing rate does decline. It does slow down in order to maintain heat. Exercise. Any sort of physical movement that you do is considered to be technically speaking, exercising. You're activating muscles. But by exercise, we're talking about actual physical stress, like you're actually applying pressure. So running, push-ups, sit-ups, pull-ups, all these type of exercises that exist. When you do these things, your body needs more oxygen to maintain itself. So you're going to breathe harder. Talking, as you can tell right now, anytime that I'm talking, my breathing rate is going to increase because I'm just expelling more air. Coughing, obviously, we've all been sick before, right? So when you have an illness or a respiratory condition, or even if you just have an irritant in your lungs or your trachea or your bronchi, you're going to start coughing and it's going to be more difficult to breathe. Volition. I would make sure we know the term volition. I would make sure we know what that means. Volition stands for conscious control. So breathing is one of those unique phenomenon that you have conscious control over it. Granted, most people on a day-to-day basis are on autopilot. Your brain is just going to do its own thing. Sorry about that. Your brain is going to do its own thing for most of the day, and you're just going to breathe without thinking about it. But breathing is one of those unique aspects that you can physically control and consciously choose when you want to breathe. And some people have mentioned this before, that sometimes it's hard to do that. Sometimes it's hard when you try to consciously breathe and think about just your breath, because there's so much on our mind. There's so much noise. There's so much distractions and stimuli that it can make it very difficult to just quiet down for a little bit and just relax. Finally, emotional factors. There are a number of different emotional factors that can affect this as well. We talked about this in a previous video, crying and laughter. Those are different ranges of emotion, right? And associated with emotion. So the various ranges of emotion that our body experiences can cause your breathing rate to be affected. All right. Chemical factors. There's a lot that can be said regarding chemical factors. I can easily summarize it for us, though, so don't worry too much. Let me talk first, and then we'll kind of summarize it. Carbon dioxide levels. Levels of carbon dioxide in the blood is the main regulatory chemical for respiration. So how much carbon dioxide there is a major, major factor. Increased carbon dioxide increases respiration. Changes in carbon dioxide act directly on the medulla oblongata. So the way to summarize this, simply put, when you have too much CO2, what is your body going to do as a response? Simply put, if I can add a little E there, breathe more. You're just going to breathe more. That makes sense. Too much carbon dioxide. Carbon dioxide is a toxin. It can kill you. So too much carbon dioxide, you need to get it out. So you start breathing heavier and heavier to breathe out all of this toxins. On the opposite spectrum, we have oxygen. What's going on with oxygen? Well, again, it's a yin and yang type situation. Changes in oxygen concentration in the blood are detected by chemoreceptors in the aorta and carotid artery. We're going to learn about those arteries as we progress. Information is sent to the medulla oblongata. So the summary for this is pretty straightforward, right? Let me move this out of the way real quick. The summary for this is easy enough. Low levels of oxygen. Oh, my bad. Accidentally was on the, where did it go? There we go. Accidentally was on the number pad. Yeah. Low levels of oxygen, as I was saying, low O2. What your body's going to do as a response, simply put, is breathe more. It's the same thing as carbon dioxide. If you don't have enough oxygen in your body, you got to breathe, because your cells require oxygen for you to survive. Makes sense. Okay. Back to where we were. Let's continue moving forward. Okay. The very last bit of content in this unit is all about diseases and disorders, a little bit of pathophysiology, as we call it. So let's talk about some respiratory conditions that can be prevalent. We're going to talk about COPD, chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, first off, I would make sure you know that that's what it stands for. This is a very serious respiratory condition. It is exemplified by chronic bronchitis and emphysema, meaning it's even worse. It's even worse under the circumstances of other conditions. So bronchitis and emphysema, which we'll talk about before we finish our video today. Major cause of death and disability in the United States. So because of how prevalent it is, we do need to talk about it. What are some of the features of this disease? Well, patients almost always have a history of smoking. It's a very common smoker's disease. Smoking anything, right? Doesn't matter what it is, marijuana, vaping, weed, cigarettes. Labored breathing is very common with this, which another name for labored breathing on a medical sense is dyspnea. Basically, dyspnea is just you have difficulty breathing. So it becomes harder and harder to breathe as your dyspnea becomes worse or as the COPD becomes worse. Coughing, even coughing blood can be common. Frequent pulmonary infections. So you start to get sick even more often. So that's what we tend to see. Now, what's the end result of this? Victims of this disease, continued, most victims retain carbon dioxide, which I realize that is a typo, so we might as well fix that on the fly. Most victims retain carbon dioxide, so they contain too much carbon dioxide in their blood. That can cause somebody to become hypoxic. Hypoxic is referring to a condition called hypoxia. Hypoxia is when you have low levels of oxygen in your blood. That can cause respiratory acidosis. What is respiratory acidosis? It's when your blood becomes acidic because of too much carbon dioxide. That's not good. That messes with your homeostasis, which is obviously a serious issue. Finally, those infected with COPD ultimately develop respiratory failure. So it depends on when you've been diagnosed with this, but at the end of the day, it's going to cause lung failure. And lung failure, anytime you hear failure next to the word of an organ, lung failure, heart failure, kidney failure, that means the organ literally has stopped working. Finally, to finish up for today, we talked about a couple conditions that can cause emphysema to be worse, or COPD to be worse. Emphysema was one of them. Regarding emphysema, the big thing I needed to know is this first bullet right here. Alveoli enlarge as adjacent chambers break through. So it's a swelling of the alveoli. And when that occurs, it can cause chronic inflammation, which can promote lung fibrosis. Remember, fibrosis is another word for scarring. And if you scar the internal organs, they're never going to be the same. The airways collapse during expiration. So when you breathe out, the airways collapse on themselves. Patients have to use a large amount of energy to breathe out, which can be tiring, exhausting. Overinflation of the lungs leads to a permanently expanded barrel chest. So in this case, when you breathe in, right? When you breathe out, you notice that your chest returns back to normal. But in the instance of emphysema, they'll breathe in, their lungs expand, and they stay expanded. So that can be very painful and obviously irritating and just a lot of tension in your chest. Finally, there is another symptom that can happen at late-stage emphysema known as cyanosis. Not a bad idea to know what that is. Cyanosis is reference to a particular color. You may have heard of the color cyan, which is like a light blue, almost like a teal color. Cyanosis is defined as bluish discoloring of the skin. So when this occurs, as far as this bluish discoloring, it's because you have very little oxygen in your blood. Typically, by the way, if someone is suffering from cyanosis because they're not breathing enough or they're not getting enough oxygen, the lips are going to start to turn blue first, then the fingers, and then the toes, and then finally the rest of the body. Okay, to conclude, we have to talk about chronic bronchitis. Chronic bronchitis. Bronchitis, if you just define that word, bronch as a prefix is referring to the bronchi, which are the tubes that, travel from the trachea into the lungs. Itis as a suffix is referring to inflammation. So simply put, that's what the first bullet is kind of telling us here. It is an inflammatory condition involved with the bronchi because of mucosa. So mucus production is going to increase rather substantially. Mucus is not a bad thing. Too much mucus is a bad thing. Pooled mucus, so you literally start to have like a pool of mucus, impairs ventilation, so how well you can breathe, and it impairs gas exchange, so how well you breathe and how well the gases actually make it to the blood. Risk of lung infection is going to increase because of this. Pneumonia is more common. Pneumonia is trapped liquids in the lungs. That could be fatal. And then finally, we talked about hypoxia already, right? That's low levels of oxygen in the blood. And then cyanosis, it's that bluish discoloring that occurs pretty early with chronic bronchitis as well. So those are things that can occur with this condition in a pretty common sense. Okay. So as you can tell, we don't have too much left. We're going to have one more video after this, and then we'll be done with respiratory system. So thanks for tuning in, guys. I'll see you guys on the next one.